Facial palsy is a condition resulting in paralysis of the nerves supplying the facial muscles, usually affecting one side of the face. These muscles enable us to communicate, speak, eat, drink and protect our eye. An altered appearance and movement can be quite concerning and difficult to cope with. It can affect our self-image, relationships and confidence with regard to work and hobbies. One thing worth remembering is very few people have facial symmetry. Often our eyes and smile may be slightly lopsided. As you or your family member is now more conscious of this, have a look around you or look at photos and see that very few people have perfectly symmetrical faces. What is facial palsy? Facial palsy is the dysfunction of the 7th cranial nerve, the facial nerve, which controls the facial muscles. Approximately 1 in 5,000 people are affected, and approximately 70% of people can expect a full recovery. Most commonly, facial palsy, or Bell's palsy, is caused by the herpes virus, causing inflammation to the nerve. This often happens to people aged 15 to 45 years, and risk factors can include pregnancy, diabetes and HIV. Other causes are the shingles virus called Ramsay-Hunt, facial trauma, facial surgery, dental surgery and other infections and viruses, as well as other causes. Types of nerve injury. Neuropraxia. The nerve is bruised or concussed, but there is no damage. This normally resolves within 8 weeks. Axonotmesis. Damage to the nerve has occurred, but the protective outer layer is still intact and therefore can improve. This may take up to 18 months. Neurotmesis. The nerve has been severed and results in surgical input. Facial anatomy. The 7th cranial nerve exits the brain from a structure called the pons. It passes through multiple small openings and passages to exit the skull just behind the ear. It then branches out into 5 facial nerves. The nerves are responsible for forehead movement, blinking, smiling and expressions. Most people with facial palsy will present to A&E or their GP with concerns that they may have had a stroke. This is very common and we would encourage anyone with such symptoms to seek medical help immediately. Once re-diagnosed as facial palsy, often steroids are prescribed to help treat the infection or virus. If medicated quickly, recovery rate is much better. What happens next? Often the GP will refer you to an eye clinic called ophthalmology for assessment and advice or your eye care. It is very important to protect your eye from dryness and infection due to the reduced blink response you are likely to experience. You may also be referred to physiotherapy. Physiotherapy. Your physiotherapy assessment will last approximately 40 minutes. We will ask you about your experience and then further questions about your functional ability. We will look at your facial symmetry and how well you are able to move. We will probably use photographs to monitor your progress. Management. Management of facial palsy includes education and support, eye care, mouth care, massage to aid symmetry and flexibility and to encourage the nerve, relaxation to avoid facial tightness and exercise for symmetry. It is important not to work too hard with your exercise as this can encourage poor movement patterns and synkinesis. Synkinesis often occurs around 4 months and is due to an immature new nerves where they may crossfire and stimulate the wrong response. Exercise advice. Please use the website for further advice regarding facial massage, stretches and exercise. As stated, please do not work too hard with these exercises. If you haven't already and think it would be useful, ask your GP to refer you to physiotherapy for further guidance. Use the links listed on our website for other useful websites and organisations for further advice and patient forums.